Good morning, all. Welcome to Facebook Live again. Sorry for the interruption. We have Dr. Pradeep G. Talwalkar, who is a consultant diabetologist. He's a highly qualified experience in the management of diabetes and related to diabetic elements. Dr. Talwalkar has been practicing diabetology for the 3 decades now, more than 35 years. Formerly a postgraduate teacher of internal medicine, he now teaches diabetology. He is very active on the patient education front. Besides conducting workshops, seminars, he uses the print, radio, television, and online media to spread awareness about diabetes among the patients and caregivers. He has authored over 50 papers in national and international journals, written and edited books on diabetes for lay people, family physician, and consultant. So, welcome, Dr. Talwalkar, for Facebook.
Good morning, Archana.
Good
Go
morning,
ahead.
sir. Sir, for awareness of diabetes, we'll ask you some questions. So I request you to please enhance our knowledge as well as spread your skill and knowledge for the people.
Okay, go
So,
ahead. Shoot the questions. I'm ready.
yeah. So my first question is, why should one try to make early diagnosis for diabetes, sir?
A very important question, Archana. First of all, let me make one thing clear. When I'm talking about the importance of early diagnosis of diabetes, I'm talking about a subtype of diabetes which is known as type 2 diabetes. Out of 1 crore diabetics in our country, about 95 lakhs of them are type 2 diabetes. Now, here, early diagnosis is very important because the type 2 diabetes starts slowly and gradually gets full and remains undiagnosed for several months to several years, up to 5 years. तो हम इसीलिए ही हम इसको छुपा रुस्तम बोलते हैं कि क्योंकि पेशेंट के बदन में छुपा हुआ होता है, उसके इनिशियली कुछ लक्षण नहीं होते, लेकिन लक्षण नहीं होते इसका मतलब ऐसा नहीं है पेशेंट पेशेंट में है. In spite of not having any symptoms, the rise in blood sugar is detrimental to the patient's health and it is gradually affecting an organ जैसा कि kidney, heart, lungs, legs, etc. Patient is not having symptoms, that's why patient is not yet knowing that he is diabetic, but gradually his organs are being damaged. If you want to prevent this, the only way to prevent this is early treatment. But early treatment can be started only after the diagnosis of diabetes. So that is the reason why diabetes should be picked up as early as possible, as soon after the disease has set in.
Okay, so thank you so much for the answer, sir. But my again next question is कि how to make early diagnosis? ये कैसे हम diagnose करें early
Correct.
diagnosis?
Very important question. How to make early diagnosis? The answer is very simple. Don't wait for the patients to have symptoms. By that time, it's too late. Go in the community and pick the people up. Remember that in India, diabetes starts about 15 years earlier than the Western people. The commonest age of onset of diabetes in Western people is about 45 years. The commonest age of onset of diabetes in our country is in that young people in their 20s and 30s. So don't wait for them to come to you. Make a rule. Every person who crosses 30 should undergo a blood glucose, a blood sugar test. No matter how healthy he is feeling, he should undergo a blood sugar test when he is 30. If it is perfectly normal, he should undergo that test every 2 years in his life. If it is borderline, he should do the next test within 3 months, 3 to 6 months. And if he is already diabetic, then after 7 days, he can do the test again to reconfirm that he is diabetic and start the treatment right at that time. अंग्रेजी में बोलता है strike when the iron is hot. So Pick them early and start the treatment. What will be the advantage of that? The blood sugar will never be allowed to rise for a long time. And that is the surest way of avoiding complications. So don't wait for symptoms. At 30, everybody must do the blood sugar. But if somebody is extremely overweight, if somebody already has high blood pressure, if somebody already has a heart disease in the family which started in the elder generation also much earlier, he should not even wait up to 30. He should start doing blood sugars from 20s onwards. In case of a lady, if she has a difficult labor or difficult pregnancy, there is a stillbirth history, or there is a history of premature delivery, or if there is a history of delivering an oversized baby, that lady, whether she's 19, 20, 22, or 23, should not wait for 30. She should go in for blood sugar immediately. So, if you have no other complications, if you have no other diseases or disorders which are associated with diabetes, and if you have no symptoms, you can wait till 30, but the first blood sugar must be done at 30. If you have a difficult labor, if you have a very strong family history, if you are already overweight, if you are already having a little bit of a blood pressure, uh, then you should do the blood sugar even earlier. Because I have seen many typical so-called diabetes of maturity onset diabetic in children who are 15, 16, 17. When I say 30, 30 means most of them get by 30, but there are some who get it at 15, 16, 17 also. So do the blood test, don't wait for symptoms at 30, and even if they are normal, periodically later on. And that is how you pick the diabetes. Nip in the bud bolta hai na, you pick the diabetes as early as possible. And after picking up the diabetes, आराम से बैठना नहीं, start the treatment immediately. Treatment may not be drugs, but treatment consists of diet, exercise, and medications as per the expert's doctor's opinion in your individual case.
Absolutely right, sir. So again, next question comes in my mind that what are the advantages if we go for early diagnosis of diabetes?
As I said, early diagnosis gives you an opportunity to start early treatment. Early treatment and a right treatment with a judicious combination of diet, exercise, and medications will bring the blood glucose swiftly to the normal and will never allow it to rise again. If that is possible, all the complications of diabetes will be avoided, and a diabetic patient will live life as long as a life of an average Indian, which is almost now 70 years. And what is more important than the longevity or duration of life, the most important thing in life is the quality of life. Everybody wants to live for a long age, but everybody wants to be independent till his last day. Everybody wants to enjoy the outdoor life. Everybody wants to enjoy the World Cup cricket and actually seeing the World Cup cricket happening and India winning. They don't want to listen to the score. They want to see the match. They want to enjoy the match. उनको देखना चाहते हैं शमी कैसा दांडी उड़ाता है सबका, खाली सुन के मजा नहीं आता. इसलिए योर विजन शुड बी देयर, और विजन के लिए डायबिटीज शुड बी कंट्रोल. सो दैट विल ऑकर इफ योर डायबिटीज इज persistently controlled. As we are in the World Cup era, let me give you an example. In cricket, there is batting, there is bowling, and there is fielding. A side which does well in all the three departments only wins. Even if you score 400, but you don't field properly and drop the catches, or if you don't bowl properly, you will lose because the opposite side will make 401. So you have to take the catches, you have to bowl tightly, and you have to score runs. Similarly, don't rely only on medicines. Relying only on medicines means relying only on batting. You have to field tightly, that means you have to do exercise. You have to bowl correctly, that means you have to do a diet. So diet, exercise, medications, all the three together, Triveni Sangam in a judicious combinations, striking at the root cause, striking when the iron is hot, and you will get all the benefits of early diagnosis and early treatment in terms of long life, in terms of long, fruitful, high quality life.
Yeah, absolutely right, sir. Sir, what do you mean by patient and doctor inertia?
You see, inertia in the minds of doctors may occur sometimes in the first level of doctors because they're too busy, they're handling too many different types of disorders, they don't have a time which they would like to spend with the patient, and its inertia is also in the mind of patient, which means that they understand the diabetes. Now we'll talk specifically in terms of diabetes. What does the patient inertia mean in terms of diabetes? They understand that diabetes is a dangerous disease. They understand that diabetes should be diagnosed. But when it comes to their own case, they are, आलसी type of thing, lazy. अरे कल देखा जाएगा, हम तो अभी कुछ भी सिम्टम नहीं है, मैं तो तगड़ा हूं, देखा जाएगा, अभी तो डायबिटीज नहीं है. So they will postpone the diagnosis of diabetes, postpone doing the blood test in spite of knowing that it is important. Ultimately, blood test is done. A little bit borderline case is there, which, as I told you earlier, means that the next blood sugar has to be done for after 3 months, and in between diet and exercise should be started to bring down that blood sugar. But when it comes to 3 months, when the 3 months are over, अरे कुछ भी नहीं है, मैं इतना ही तगड़ा हूँ जितना पहले था, मैं उतना ही भागता हूँ जितना पहले भागता था. पोस्टपोन. आज क्या है, आज ऑफिस में बहुत ज्यादा काम है, आज क्या है, घर में फंक्शन है. तो postponing the things, not taking the right decision in spite of knowing, देखा जाएगा, ये एटीट्यूड जो है उसको inertia बोलते हैं. This is a dangerous thing. Because of this, the patient doesn't go to the lab to do the test. Even if it goes to the labs after the family members repeatedly tell him or his doctors repeatedly tell him, and the results come which are not very favorable, they don't take the right action in terms of diet and exercise, and they don't take the right action in terms of follow-up test after 3 months. They also show lethargy there. They also give importance to some other things in life and don't execute the things which they should have done. And this is known as patient's inertia. And this is the biggest stumbling block coming in the way of early diagnosis, coming in the way of early treatment after early diagnosis, and coming in the way of avoiding complications.
Right, sir. Sir, as your experience and you know this like see, you know, so मैं एक रिक्वेस्ट करना चाहती हूँ सर कि जैसे कि आपका एक्सपीरियंस है, आपका स्किल आपने बताया, सो कुछ एविडेंस है जो कि सपोर्ट कर सकता है अपने ये सब पूरे कन्वर्सेशन में. सो
Yeah.
हैव एनी एविडेंस टू
आपने अच्छा क्वेश्चन पूछा. I will give you a full answer to it. देखो, मेडिसिन ये एक साइंस का ब्रांच है और साइंस में एविडेंस सिवा आप बोल नहीं सकते हम लोग, वो बराबर नहीं है. तो मैं जो कुछ आपको एडवाइस दिया, सलाह दिया, मशवरा दिया, वो मेरे पास एविडेंस है, उसके आधार से ही मैं दिया. अभी क्या एविडेंस है? आप तो लेमैन है, तो मैं ज्यादा से ज्यादा सिंपल भाषा में जो एक्सपेरिमेंट किया था, जो रिसर्च किया था, वो सिंप्लीफाई करके आपको बोलता हूँ. I will give you what they did to prove that early diagnosis and early treatment is very important. ये वेस्टर्न कंट्रीज में ये स्टडी हुआ था, हजारों डायबिटिक पेशेंट जो उनका डायबिटीज का निदान हाल ही में हुआ था. सून आफ्टर डायग्नोसिस ऑफ डायबिटीज they started the treatment. At the end of 6 months, the treatment was in the hands of individual doctors. It was not in the hands of scientists who had designed the trial. At the end of 6 months, based on their blood sugar control, the patients who had a recent diagnosis of diabetes and who were put on early treatment were divided into three groups. Those who were very tightly controlled, those who were moderately controlled, and those who were poorly controlled. So a classification based on what is their control was done 6 months within a very short time after the diagnosis of diabetes and starting the treatment was done. Subsequently, they were analyzed that on yearly basis. Their doctors were allowed to continue the treatment in the way they understand the diabetes and the way they treat it to the best possible extent. At the end of 10 years, 10 बरस के बाद जब ये रिसर्च प्रोजेक्ट कंप्लीट हुआ, जब जेव्हा रिसर्च प्रोजेक्टची सांगता झाली, the analysis was done. And what they found out, those who were very tightly controlled at the end of 6 months had minimum heart complications, minimum kidney complications, minimum eye complication, and the best quality of life. Those whose diabetes was not controlled at the end of 6 months had the poorest outcomes, more complication, lesser quality of life. And those who were moderately controlled were somewhere in between, irrespective of whatever their control was at end of 1 year, 2 years, 3 years, 4 years, 5 years, 10 years. समझ लो, उसका मतलब ऐसा है कि ये जो 6 महीने के बाद जिनका टाइट कंट्रोल था, उनका कंट्रोल जरा बाद में खराब हो गया तो भी वो उन्होंने बेस्ट रिजल्ट हासिल किया, और 6 महीने के बाद जिनका कंट्रोल अच्छा नहीं था, उनके आंख खोले गए और बाद में वो सुधर गए, और बाद में उनका कंट्रोल सुधर गया तो भी उनको अच्छा रिपोर्ट नहीं मिला. Those who did best at the end of 6 months remained free of complications and had highest quality of life at the end of 10 years, irrespective of whatever happened to control in between, irrespective of some of them having a worse control after a very tight initial control. And against that, those who did not have good control opened their eyes, gathered the knowledge, woke up too late, and then controlled diabetes very tightly, did not have the best results. So, tight control in the initial 6 months prevents the blood vessel damage later on by keeping the blood vessels healthy. Once the blood vessels are damaged because of poor control in the initial months and years, no matter how you work hard, no matter how you improve later on, you will not get all the benefits. So don't miss the bus. Strike when the iron is hot before it's too late, and reap the benefits of this kind of aggressive policy throughout their life by having longevity and having good quality of life. Thank you.
थैंक यू सो मच सर. आपने बहुत ही अच्छे से समझाया जो भी हमने आपको क्वेश्चंस पूछे. आई गेस सबको अच्छे से नॉलेज भी मिला है और हमारा भी नॉलेज आपने इनहांस कर दिया. Again, thank you. I'm grateful for giving your valuable time for this talk, sir. Thank you so much once again.
Thank you, Archana, and all the viewers. Thank you.
Thank you, sir.